am a mom of 3 beautiful kids, Hawk, Brooks, and Hope, and I've been a single parent for 10 years, and they are the pride and joy of my life. I'm very involved as a family physician. I just was having some abdominal pain and thought, well, maybe I have an ulcer, just with everything going on, and it turns out I had pancreatitis. And that's how we led to the diagnosis, because I got an ultrasound and then ultimately a CAT scan, and learned that I not only had a tumor in my pancreas, but I also had metastasis that had spread to my liver. Well, pancreatic cancer is kind of a tough one because they really haven't developed a cure for that one yet, but I believe that cure is just around the corner and will occur during my lifetime. It's tough for things to penetrate the pancreatic tumors because they have a real thick stromal border, which is like scar tissue. So it's hard for chemotherapy to penetrate those tumors. And so that's why a lot of the new technology, even the immunotherapy medications, are not working for pancreatic cancer. So it just jumped to 3rd place with the highest incidence for new diagnoses. And yet it is probably the most lethal.
Tell us what it was like when you first learned you had cancer.
Really I was shocked because it was probably one of the busiest yet happiest times. I was, busy taking care of the kids and volunteering at their school and being involved with them. I was busy working full-time as a family physician, and then I was also teaching for an academy, and had actually just taken a trip overseas to teach in Singapore. Is that I would go and meet with these different specialists around the country, and I'm a pretty open book, passionate person, and I would take their hands and I'd hold them in mine, and I'd say, I just need 10. And they'd kind of look at me and say 10 months, and I'd say, no, I need 10 years so that I can raise my kids and see them through high school. And they just kind of looked down. They couldn't even look me in the eyes. And then I went to Scottsdale, Arizona, because I heard about a wonderful physician there who was a dear colleague and friend of my physician here, Dr. Cohn. And I flew to Scottsdale and I met with Dr. Daniel von Hoff. And he was the first physician who really had a different response to me when I said that to him. And he looked at me and held my hands back and he said, Dr. Jill, why would you stop at 10 years? And I thought, wow, okay, I need someone who's going to believe in me. I didn't realize it at the time, but I think in the 20 years that I was ministering to my patients, they always knew that I believed in them and I would go that extra mile for them. But I think now, being a patient, I realize that those are the most key words that you can tell anyone. I believe in you. And that means the world to you. And it doesn't mean that you have to have cancer to hear those kinds of words. I mean, we should be telling that to each other in any circumstance. I mean, just within a family, or if someone's struggling with a change in life, whether that might be an ill loved one, or a move, or a job change, or a divorce, or anything like that. Just that you believe in that person, I think it really inspires them and gives them hope. And that's really what I'm trying to do now, is to use my story and my journey, and we're very open and honest about that, to inspire others, and hopefully I can be a beacon of hope so that other people will know that don't give up. Lean on God and your faith and the people around you, because you can do this.